Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. And let's talk about this pandemic. Well, it's January 4th, and a Happy New Year to each of you. And hopefully it will be in this brave new world we live in. In this video, the update we've been waiting on. Now that we are about 10 days out from Christmas time, let's see where we are. And please, share this with someone you care about. Recall these are 7-day average rates of new cases per 100,000 population. Less than 10 is the goal, less than 1 is ideal. And you can see our neighbors all substantially higher than before Christmas. North Carolina, now the 7th highest in the country for rate of new cases. Highest among our neighbors now. All counties in the state now in the red, all more than 40 per 100,000, and none even close to the red zone threshold of 25. In western North Carolina, the actual 7-day rolling average of new cases here in parentheses. And for Haywood County, the goal is less than 6 new cases per day. As you can see, everyone's in the red, and everyone's substantially higher than before Christmas. Haywood County has essentially doubled our rate of new cases. Today, as of January 4th, the total for the pandemic is 2,332 cases, and it took until November 30th, 9 months, to reach the first 1,100 cases. It took another month, December, to add the next 1,100. The total in isolation is now at 284, and you can see the continued divergence between this number and the week-over-week additional cases. And 98 of those in isolation who are active cases are long-term care facility related. 2/3 are not. And of the last 1,100, only 122 are long-term care facility related. In Haywood County, the numbers are being driven by community spread. Test positivity now 14.3% for North Carolina, 11% for Haywood County, and recall that below 5% is the goal. Hospitalizations across the state on a steady uphill trend. ICU admissions as well. At Haywood Regional Medical Center, they have been averaging around 6 COVID-related admits, but this has jumped to the 20s, reaching as high as 29 last weekend, back down to around 20 today. This is really stretching the system and an already tired staff. And the same is true across western North Carolina and the upstate of South Carolina. We've been seeing frequent diversions, meaning a hospital has to halt receiving patients, sometimes certain patients and sometimes all patients, at times. Increasing cases precede increasing hospitalizations, and we know that precedes increasing deaths. In Haywood County now, 78 people have died, 28, a third of that total, in December alone, and our first death in someone under the age of 60. That's a case fatality rate of about 3.4%, meaning 3 to 4 out of every 100 people infected die. And in Haywood County, these people were infected by someone younger in most cases. Remember, it takes 7 to 10 days to see the effect of people's actions, so we certainly had a flattening of cases between Thanksgiving and Christmas. Not the decrease we had hoped for, as we had anticipated a spike from Christmas, and that we are now seeing. Here is the case curve for North Dakota. I've often used their experience as a perspective for our own. Their 7-day rolling average was as high as 216 in November, now all the way down to 29. And if there is a good note for Haywood County, here it is. We have yet to get that high, and we certainly would have been higher without that brief flattening. So it appears we did not take full advantage of the window of opportunity we had. What will New Year's activities leave us with? Well, we should know in another week. But it looks like we will just be laddering on top of the high levels we already have. But it's never too late. We can impact the levels we will have following New Year's, so that later in January, our numbers will go down. So our focus is again the next 2 weeks. If you can see fit, avoid crowds, and if you can't, wear a face covering. Keep your distance. Limit the time around anyone outside your immediate family. And if you haven't done this up until now, it's time. Time to join with others doing their part. Everyone is needed to slow the flow now. And with the addition of the vaccine, we can still get ourselves in a more favorable position come early spring, so we can gather safely together again then. And that starts now. So be well and be careful, especially right now.